Welcome to While We Were Distracted, the podcast where we explore topics that often get overshadowed in the rush of daily life.
Okay, so get this. Imagine, right, a medical mystery that could totally rewrite what we thought we knew about the early days of COVID. Remember back in 2019 when a bunch of people, mostly young folks, started getting really sick. I mean, really sick, with lung problems, and some even died, and it was all linked to vaping.
Yeah, it was a massive public health scare. Thousands of cases across the U.S. Doctors were really struggling to figure out what was going on.
Exactly. And at the time, everybody was focused on figuring out what specific chemical in those vapes was causing the trouble. But now,
Right.
well, now some folks are suggesting that, and this is a big maybe, just maybe, some of those cases were actually early COVID infections that were just, flying under the radar.
It's a wild idea, isn't it? But there is some evidence that's making people look twice at those 2019 vaping cases. We've got medical reports from back then, examining lung biopsies, articles from the big names, the New England Journal of Medicine, the CDC, even news stories about how the government reacted, like flavor bans and all that.
So that's what we're going to dig into today, see if there's really something to this theory. And, this isn't just some random internet conspiracy theory. This is, if this turns out to be true, this could change how we understand the whole COVID-19 pandemic.
Absolutely. It could rewrite the timeline of the pandemic, even help us prepare better for future outbreaks.
Okay, so let's start with what we knew back in 2019. What was the situation with this vaping illness outbreak?
Well, it was pretty scary. People showing up at hospitals with coughing, shortness of breath, just totally wiped out. And tragically, some didn't make it. Over 2,000 cases, at least 33 deaths, mostly concentrated in about 24 states.
And a lot of these people were young, right?
Yeah, the majority were under 35. And initially, everyone thought it was some kind of rare pneumonia caused by oils building up in the lungs. They called it lipoid pneumonia. Some vaping liquids have oils in them.
So they thought these oils were basically gumming up people's lungs.
Right. But here's where things get interesting. Doctors at the Mayo Clinic studied lung biopsies from 17 patients. And guess what?
What? They didn't find any signs of this lipoid pneumonia?
Nope. No signs of it.
No kidding. So what did they find?
Well, instead of oils, the biopsies pointed to damage you'd see from, inhaling toxic fumes or gases. They called it direct chemical injury, like something in the vapes was acting like straight-up poison.
So at that point, everybody was looking for some bad chemical, not a virus.
Exactly. Remember, this is October 2019, way before anyone had heard of COVID-19. The Mayo Clinic suspected it might be contaminants or, nasty byproducts from heating the liquids or something else toxic in those vapes.
But now looking back, with what we know about COVID-19 and how it messes with your lungs,
Yeah.
it makes you wonder, right?
Yeah, it really does. In fact, someone even sent a fax to medical examiners urging them to take another look at vaping deaths from September 2019, especially in Seattle. Seattle was one of the first places COVID hit really hard in the U.S.
That's wild. I mean, thinking back, those early COVID symptoms, the cough, shortness of breath, fatigue, sounds a lot like what those vaping patients were going through.
Yeah, there are some pretty striking similarities, and it's important to remember that the initial symptoms of COVID, they could be all over the place. From feeling like you just have a mild cold to, needing a ventilator to breathe.
So while everyone was scrambling to find that one bad chemical in vapes, a virus could have been, quietly spreading, causing the same problems.
And the CDC itself, while they were focusing on THC vapes at the time, they also noted that there were similarities in the lung damage patterns between the vaping illness and COVID-19.
Hold on, back up for a sec. THC vapes, what's the connection there?
Well, back then, the CDC was really zeroing in on THC-containing products, the kind, you'd use to get high. Over 3/4 of the vaping illness patients reported using those types of vapes.
So maybe the THC vapes were contaminated somehow?
It's possible. But even then, the exact cause of the lung injuries was never totally clear. They never really found one single chemical culprit that explained everything.
Okay, so we have this idea that some of those 2019 vaping illnesses might have been, misdiagnosed COVID-19 cases and some hints that maybe THC vapes were involved somehow. But how do we even begin to prove this?
That's the tricky part. To know for sure, we'd need to go back and re-examine tissue samples from those 2019 vaping cases, look for the actual COVID-19 virus itself.
Yeah, that makes sense. But isn't that going to be super difficult? I mean, finding those old samples, making sure they're still good, running those fancy tests to find the virus. It's a lot.
You're right. It would be a massive undertaking. And even then, no guarantee of success. The virus might have degraded over time, or the samples might not have been stored correctly.
So it's like trying to find a tiny speck of dust in a giant warehouse after a hurricane is blown through.
Yeah, pretty vivid image and not far from the truth. But even if those biopsies don't give us, like, a definitive answer, there are other ways to investigate this. We could look at the epidemiological data, for example.
Epidemiological data, you mean like where those vaping cases were happening and when?
Exactly. If we map out the vaping cases and compare that to the early COVID hotspots, we might see some interesting overlaps.
Okay, so like if we see a bunch of vaping illnesses popping up in the same places where COVID was later spreading, that could be a big clue.
Precisely. It's about connecting the dots and seeing if a pattern emerges. And the timing of those cases matters too. Did they cluster in a way that matches what we now know about those early waves of COVID?
This is starting to feel like a detective story. We've got our mystery illness, potential clues in those vaping cases. Now we're trying to put all the pieces together and see if they fit.
You got it. And if this hypothesis turns out to be true, well, the implications are huge.
I bet. So let's assume for a minute that we do find strong evidence that some of those vaping illnesses were actually early COVID cases. What does that change? Why should anybody care?
Well, for starters, it means our understanding of the pandemic's timeline is way off. If the virus was already in the US in September 2019, it had a much bigger head start than we thought.
Wow, that's mind-blowing. It could mean that the virus was already circulating in communities, maybe even spreading without causing any noticeable symptoms.
Exactly. And that raises a whole bunch of new questions about how widespread it really was back then, how many cases were missed or misdiagnosed.
And think about the public health response. If we'd known it was COVID all along, maybe we could have done things differently, taken steps to contain it earlier.
It's impossible to say for sure, but it's a crucial question. Understanding the true extent of the virus's early spread could have completely changed how we responded to the pandemic.
This is getting pretty intense. I think we need a moment to process all of this.
Absolutely. Let's take a pause here and let everything sink in. We'll be back in a moment to explore some of the other implications of this hypothesis and what it could mean for our understanding of the pandemic. Welcome back. So before the break, we were talking about how this hypothesis, if it's true, could rewrite our understanding of those early days of the pandemic.
Yeah, it's a lot to take in. I mean, thinking that COVID could have been spreading silently, right, while everybody was focused on those vaping illnesses, that's kind of freaky.
It really highlights how much we still don't know about this virus and how easily it can spread under the radar.
Okay, so where do we go from here? What else can we do to, like, figure out if this theory holds any water?
Well, we talked about re-examining those lung biopsies from 2019, but as we discussed, that's going to be a long shot. However, even if those samples aren't viable, there's still valuable information hidden in the data we already have.
Like those epidemiological maps we were talking about.
Exactly. We could start by analyzing where those vaping illnesses were clustered, see if those locations align with places that later became, early COVID hotspots.
So if we see a bunch of vaping cases popping up in, let's say, Washington State back in September 2019, and then a few months later, Washington becomes a major COVID epicenter, that'd be a pretty strong connection.
Right. Absolutely. And remember, we're not just looking at location. The timing of those cases is crucial, too. Did those vaping illnesses peak right before the first official COVID cases started appearing?
Okay, so we're looking for a pattern. Vaping illnesses popping up in specific locations just before COVID takes hold in those same areas. It's like those vaping cases were like an early warning signal that everybody missed.
That's a great way to put it. It's like the virus was sending out a distress signal, but we were, tuned to a different frequency.
And if we can confirm this pattern, what does that tell us?
Well, for one thing, it would solidify the idea that COVID was circulating much earlier than we initially thought. We might even be able to pinpoint specific communities where the virus, took root before it exploded onto the global scene.
That's huge. It would change our whole understanding of how the pandemic unfolded.
It would also highlight the importance of early detection and surveillance. If we had recognized those vaping illnesses as potential COVID cases back then, imagine how differently things might have played out.
Yeah, we might have been able to implement testing and contact tracing earlier, maybe even slow down the spread before it became a full-blown pandemic.
It's a sobering thought, isn't it? Shows just how crucial it is to be prepared for the unexpected, to have systems in place that can identify and respond to emerging threats, even when they present in unusual ways.
Okay, so let's imagine for a moment that this theory is confirmed. We've rewritten the pandemic timeline. We've learned valuable lessons about early detection. What else? What are the broader implications?
Well, it raises a lot of intriguing questions about the nature of the virus itself. Was it less deadly in those early stages? Did it evolve over time to become more transmissible, more virulent?
So maybe those early cases were milder because the virus hadn't yet developed those, like, nasty traits that made it so dangerous later on.
Exactly. It's possible that the virus was still adapting to its human hosts, gradually accumulating mutations that made it more efficient at spreading and causing disease.
It's a bit unsettling to think about, but it makes sense. Viruses are constantly changing, trying to find ways to survive and reproduce.
And understanding how this particular virus evolved could be key to developing more effective vaccines and treatments in the future. We need to stay one step ahead of it.
So this hypothesis isn't just about rewriting the past. It's about informing our future strategies for dealing with pandemics.
Precisely. It's a reminder that we can't afford to be complacent. We need to be constantly learning, adapting, and investing in research and public health infrastructure.
All right, let's shift gears for a moment and talk about the government's response to the vaping crisis back in 2019. You mentioned earlier that Michigan banned flavored e-cigarettes, and then the Trump administration announced a plan to ban them nationwide. What was the thinking behind those decisions?
Well, the main concern was the impact of vaping on young people. Flavored e-cigarettes, with their, enticing flavors like cotton candy and mango, were seen as a gateway to nicotine addiction. And there was growing alarm about the potential long-term health consequences.
Yeah, it seemed like vaping was suddenly everywhere. Now, a lot of parents, educators, health experts, they were really worried about kids getting hooked.
Exactly. And there was also the immediate concern about the vaping illness outbreak itself, which was still a big mystery at the time.
So these bans were meant to protect young people from both the known dangers of nicotine and the unknown risks of those mysterious vaping-related illnesses.
Precisely. It was a two-pronged approach. Protect the kids and try to get a handle on this outbreak that was causing serious lung damage.
But here's where things get really interesting. If we connect this back to our hypothesis, those bans might have actually had an unintended consequence, right? Slowing down the spread of COVID-19.
That's the fascinating part. If those vaping illnesses were indeed early COVID cases, and if vaping, especially of flavored products, was somehow facilitating transmission, then those bans could have inadvertently thrown a wrench in the virus's plans.
Wow, that's like a double whammy. Governments trying to address one public health crisis might have accidentally helped to mitigate another one that nobody even knew existed yet.
It highlights the interconnectedness of public health issues and how actions taken in one area can have ripple effects in others. It's a complex web, and sometimes even unintended consequences can play a significant role.
It also makes you wonder, if those bans were in place and they did have an impact on COVID transmission, what would have happened if they hadn't been implemented? Would the virus have spread even faster? More widely?
It's impossible to say for sure, but it's a thought-provoking question. It underscores the importance of understanding the potential consequences of our actions, both intended and unintended, especially when dealing with complex public health challenges.
Okay, so we've got this hypothesis that some of those 2019 vaping illnesses might have been misdiagnosed COVID cases. We've talked about the evidence, the challenges of proving it, and the potential implications if it's true.
We've also explored the government's response to the vaping crisis and how those actions, while intended to address one public health concern, might have inadvertently played a role in mitigating the spread of another, even more significant one.
But there's still one big question lingering in my mind. If those early cases were indeed COVID, how did the virus get into those vaping products in the first place?
That is the million-dollar question, and unfortunately, one we may never have a definitive answer to.
Okay, I think we need another pause here to let that sink in. We'll be back in a moment to explore that question further and wrap up our deep dive. Okay, we're back, and I gotta say my head is kind of spinning after that last segment. If those vaping illnesses back in 2019 really were early COVID cases, how on earth did the virus end up in those vaping products?
Well, it's a puzzle, for sure. A lot of missing pieces. But there are a few scenarios I think worth considering. One possibility is that the virus was already present, in those raw materials used to make the vaping liquids. Imagine if those ingredients were sourced from a place where COVID was already circulating, maybe even before it was officially recognized.
So like a factory worker, let's say in China where we think the pandemic started, could have been infected. And somehow the virus got into like a batch of ingredients that were shipped to the US and then used in vaping products.
Exactly. Not far-fetched at all. Or contamination could have happened during the manufacturing process itself. Think about it. If a worker in a vaping liquid factory was infected, they could have, unknowingly spread the virus through coughing, sneezing, or even just touching surfaces.
Ugh, kind of gross.
Yeah.
But I guess it makes sense. Viruses can be sneaky little things.
Oh, they really can. And let's not forget about the possibility of contamination happening further down the line, maybe during packaging, shipping, or even at the store where people buy their vapes.
So basically anywhere along the way, from those raw ingredients to the moment someone takes a puff, there's a chance for the virus to sneak in.
Precisely. And given how easily COVID can spread, right, through respiratory droplets, contaminated surfaces, it wouldn't take much for those vaping products to become, like unwitting carriers.
This is starting to feel like a game of epidemiological whack-a-mole. You try to block one potential route of transmission, and the virus pops up somewhere else.
A very apt analogy. It highlights just how challenging it can be to track the origins and the spread of a novel virus, especially one as adaptable and transmissible as, COVID-19.
It also makes you wonder if those vaping-related illnesses we talked about were just like the tip of the iceberg.
That's a very real possibility. If the virus was indeed, contaminating vaping products back in 2019, it's entirely plausible that many more people were infected, but either didn't develop any noticeable symptoms or had such mild symptoms that they just brushed them off as a cold or the flu.
Wow, that's a sobering thought. It's like this whole hidden layer of the pandemic that we might never fully uncover. So where does that leave us? What are the key takeaways from our deep dive today?
Well, I think the biggest one is that our understanding of COVID-19 and its origins is far from complete. The evidence we've explored today suggests that the virus might have been circulating undetected far earlier than we initially thought, possibly even before those first official cases in late 2019.
And this possibility, if confirmed, would completely rewrite the pandemic's timeline and raise serious questions about how we missed those early warning signs.
It also underscores the importance of, remaining open to new evidence and challenging our assumptions. We can't afford to be stuck in old ways of thinking when it comes to emerging infectious diseases.
Absolutely. We need to be adaptable, vigilant, and willing to connect the dots, even when they seem really far apart.
Exactly. And this case also highlights the interconnectedness of public health issues. What seemed like a vaping crisis might have been intertwined with the early stages of a global pandemic. Actions taken to address one problem might have had unintended consequences, both positive and negative, on another.
So we're left with more questions than answers. But that's often the case in science, isn't it? The journey of discovery is all about exploring the unknown and constantly refining our understanding.
It's a reminder that we need to be humble in the face of complex challenges and embrace the fact that we might not always have all the answers.
Well said. As we wrap up this deep dive, I'd like to leave you with one final thought-provoking question. If some of those 2019 vaping-related illnesses were indeed misdiagnosed COVID-19 cases, how does that change your perception of the pandemic's timeline? What does it tell you about the importance of early detection and a proactive approach to public health? Keep exploring these questions, and thanks for joining us for this deep dive.
Thanks, everyone.
Don't forget to like and subscribe for the next episode on While We Were Distracted.